We are continuing the topic number 8, and as I have mentioned to you, right now we're going to talk about one of the social diseases which influence the global development of the dilemmas and also the bioethical dilemmas of the existence of the personhood and the way how it's perceived, and the progressive development of the medicine right now give the new treatment, new way of understanding the actually such a problem as HIV/AIDS. But the role of the personhood and its inside nature, getting the also connection with the psychosomatic importance of the recovery. So that's why the ethical problems and the moral judgments which we will face with under the understanding of problem of HIV give us another point of view on the way how to formulate the problem for the social diseases in general. This example of HIV way of moral judgments will also help us to gauge the prognostic understanding of actually bioethics. People with AIDS suffer from a progressive decline in the function of their immune system, a consequence of which is a greater likelihood of developing opportunistic infections. And such a thing as the opportunistic infections then influence actually the mental ability and the somatic importance of the personhood. That's why the question which will be raised at the vision and the construction of the bioethical recovering and moral judgment concerning HIV people with AIDS. That will also show to you the way how the social influence, social values will help to recover such a person. And for sure, for me, the first person who prima facie who was getting when I thought about HIV, and this person is Freddie Mercury, and his history of life, and one of the things which were important for me is the way how he up to the last day of his life getting its sufficiency to show the people his talent, and that's actually overcoming and the stage when the moral judgment help the person to be oneself, to be the personhood. There has been numerous interests in AIDS from bioethicists, and such an interest also raised with the question of the social ability to recover and social ability to implement the judgment over the doctors who are getting, over physicians who are relating with the recovering, and of course to the people with AIDS. There were many reasons also for the scientific approaches of including bioethicists in the question of the AIDS. Among them, the fact that HIV is sexually transmissible and has the potential to kill an infected person many years after an infection. And such a long distance provoke bioethics and bioethicists to understand how it's happened and the way how people are getting suffer from such an infection. And of course, the structure, the position of the society also play an important role for understanding of the bioethics. And here the distance years after infection play the connective role to the social rules which have been formulated by the social treatment, have been formulated by the society. Let's think what bioethics approach of the HIV/AIDS and what kind of moral judgment supposed to be understand and supposed to be researched while we are talking about HIV/AIDS problem. Bioethics have been concerned predominantly with such a list of the issues. First of all, that's HIV testing, and as the institutional procedure of understanding the personal infection, getting the infection to the personhood. The second issue for the psychiatrist is whether the HIV infection acquired during voluntary and safe sexual encounters should be considered a case of harm to others or harm to self. Here, you remember the problem of harmless, which was first described at the abortion topic, and after that at the psychiatric problem. Right now, get the more influential to the cases of personhood and cases of the relation to the self. And for sure, the sexual encounters of the HIV infection is supposed to be understood with the reasoning, the way how people were getting to the infection itself, and to those who were partners at the sexual abuse and sexual encounters. Third issue for the understanding of bioethics and the formulation of HIV/AIDS, that's AIDS clinical research and access to experimental drugs. While we were talking previous classes concerning the genetical issue, also that were experimental way of understanding the genetic research. Here also the clinical research concerning AIDS and type of the implementing of experimental drugs by the pharmacy, also the bioethical question of the personhood. Will person survive after such an experiment, or will mental ability of the person who were infected by the HIV will constructed the new reality for the personhood, and such term as the autonomy will also be transmitted and used at our research, used as our discussion concerning clinical research. This is the third problem. The fourth problem for the bioethics, the fourth issue, the fourth dilemma is access to affordable life-preserving medication, and the construction of the life-preserving medication institutions for life-preserving for the people who have AIDS. That's also the question of the social responsibility. That's also the moral questions and the influence of the bioethics to the legal procedure, because life-preserving medication is supposed to be clear provided by the society and the social constructed communities, and of course the question on the way how such medication is supposed to be provided, that's the question of the bioethical issues. The fifth issue at the bioethical level, that's the problems surrounding HIV-infected healthcare professionals, because the question for the doctors, the question for the physicians, and the duty to treat people with HIV and AIDS, that's the duty also over themselves, over the personhood. Not just the person of the personality, personal problem of the doctors or the physicians, but also surrounding people, also the social environment in which the doctor, the physician lives and provides its social duty. That's why this interconnection, you see, once more we are coming to the first topic, and we are underlining at HIV/AIDS problem and the moral judgments concerning it, retrospective functioning of the science itself. It's bioethics constructed, you see, the three main levels of the science: natural sciences, humanitarian sciences, humanitarian disciplines, and the social sciences, and its practical implementation especially for the humanitarian understanding, because the moral effects, the effects of the value over the people who have AIDS, it's important, and people who are protecting the and making the professional treatment of a HIV infected person, that's important for the understanding of the bioethics and its future research. Let's come to the first point. The general consensus among bioethicists at the time was that mandatory testing is, all other things being equal to those who are starting their treatment, only acceptable when there is a successful therapy for the disease available. The line of argument, which is based in part on the importance of respect for individual autonomy, has been accepted by those health officials responsible for the AIDS policies of most Western countries, and the policy has been changed because the question of the testing, the question of the HIV test, getting right now the question of the individual autonomy and individual response of the person, responsibility over oneself and over the social environment in which one's living. And the question of the moral judgments concerning the autonomy of the person in such a vision supposed to be perfectly presented, perfectly underline the construction communications of such a person to the social reality. For sure, it's quite difficult while person has no connection to the medical service, and it's important for the protecting the society over the HIV/AIDS problem. This question of autonomy also getting in the conflict, getting in the tensions with the vision of the social responsibility of the policies, and also AIDS policies, not just in the rest of the world. It accepts essentially that until there is a clear benefit, and we have underlined this because the clear benefit is also the formulation of the legal procedure of the testing, HIV testing, to the infected individual from knowing about one's infection. There is no paternalistic reason to implement mandatory testing. And we are coming again and underlining the formulation of the social role at the recovery of HIV/AIDS. That's paternalistic reason, and this social role of the policies of the HIV/AIDS problem, of HIV/AIDS people with HIV/AIDS. That's the question of the real strict line on the legal procedure of the society, legal procedure of the policy itself. Such a condition no longer holds true at the countries which have the deliberation procedure, which implement the connective way of understanding this problem, HIV. There are now treatment regimes that are capable of substantially improving the quality of life of people with AIDS and preserving their lives, so the testing itself getting the more requirements on the autonomic choice itself. The second condition that's interfering with the partners, interfering with the social environment of the persons who have AIDS. Of course, a lot of research have been made, and for sure we will talk about the case during the practical classes, which shown to you one of the situation, and this situation will provide you with the influence of the bioethics, will provide you with the influence of the values over the human statement And such a thing as the moral judgments in the case of the social environment, in the case of the autonomous understanding of the person in the social environment, that's also the question for the formulation at the educational level. That's why we are raising it. Interfering with individual choices by means of the criminal law is traditionally defined on moral grounds only when there is a need to prevent and or punish harm to others. As we have mentioned, need to prevent as the social role, as the paternalistic strategy of the society, and to, of course, punish the harm as the part of the justifying, as a part of the justice. The use of the criminal law to prevent consenting adults from harming themselves has been seen as much more problematic in the contemporary world, because the liberation procedure and the liberal approach are getting more influence to the personhood. And especially at the last 3-5 years, the role of the social grouping and the equality have been increasingly raised, even in the countries which not related with the European society. At issue is the fact that most infections that are a result of sexual encounters occur as a consequence of voluntary consensual acts among adults. Liberals, which I have mentioned to you, liberal approach, have argued that under such circumstances there is no room for the criminal law. That means there is no usage for the paternalistic approach over the policy, over the state policy in this case. The option of justifying interventions by health authorities through paternalistic strategy still remains at the policies of the Western countries, and doesn't look prima facie unreasonable, doesn't look the first glance unreasonable. After all, society supposed to and still will play will play role of interfere to prevent harm to self, to prevent harm to the individuals, and to prevent then harm to the social group and social interventions. Empirical researches, which we will also discuss, has demonstrated that the majority of communication in sex is non-verbal. Hence, duty to disclose. Yes, you understood. Duty to disclose could not mean that it's duty on the side of the HIV-positive person to say explicitly that one is infected, because this would violate the basic rule of conduct. And the ethical problem here is actually responsibility and the understanding that autonomous role, autonomous category of the personhood supposed to be linked to the social responsibility, supposed to be linked to the responsible, explicit understanding of the another person. That's why the side of the HIV positive person to say explicitly that one is infected, that's actually the bioethical problem of the open mind, bioethical problem of the deliberative procedure. Here, the problem for the bioethics also to make the society not just pay harm for those HIV positive persons, but also to make responsible attributive collaboration. This means to work together over the person's problem, over the connection of the person to the society. For sure, the first and the third and the fourth problems, fourth and the fourth issues, while we are talking about the usage of the treatment, correlate us with once more with the pharmacology. Certain drugs might have extended patients' survival time, that's for sure, and we have mentioned the fourth problem that life time treatment supposed to be provided by the social needs, by the social interest, social policy. But ultimately the patients would succumb to a disease that was life-threatening and incurable. In contrast to some other life-threatening diseases we have at HIV/AIDS, tended to be fairly young and were more likely to put up a fight present over during the whole lifetime. And in comparison with the other such a life-threatening diseases, we supposed to create bioethics, supposed to create certain strategy over the existence of the personhood of the society. And that's the problem for the bioethics, that's the problem for the introduction of new ethical values to the social circumstances, to the social worldview. It happened to society that people who have problem with AIDS becoming the dilemma, becoming the problem how to make the construction, how to not prevent their reservation on the certain amount of the development of the social implementing of such people to the constructs which we have in society. Of course, it will be a problem for the person, the life problem for the person, especially when we're talking about fairly young part of the society. This view claims that autonomous, terminally ill individuals have a right to take charge of their own lives. The objections are twofold. The first is strongly paternalistic, and it concedes that patients are actually aware of the risk they are running when they take unapproved drugs, but maintains that it's not in their best interest and that these patients very probably will harm themselves or will be subject to exploitation by ruthless quakes. And the problem for unapproved drugs, also for the testing of the new drugs, that it can be unreasonably used by the changing of the, as you can see, the consciousness effect. The second major argument against the patient's access to experimental drugs has been advanced on the grounds that this constitutes harm to others. And this also the social problem. That's why we have underlined the social value of the harms to others important while we are discussing this usage of the unapproved drugs. At this point, the connection between access to experimental agents and the ethics of research clinical trials becomes apparent, and these interrelations between the research and actually experimental agents and the theoretical researchers theoretical understanding of the ethics, it's important for the clinical trials and for the further understanding of the development, how the clinics will help these people to constitute themselves. Bioethicists and AIDS activists, that means those people who are getting together, the social activists, the later, mostly in developing countries, have focused their attention on the other issues related to research ethics. A serious ethical challenge arises with regard to the question of what is owed to participants of HIV vaccine trials who happen to become infected during the course of the trial. And here the problem of the infection during the course of the vaccine trials, getting a lot of problems to the pharmacy. And of course, sure, that's the practice of the pharmacy is supposed to be clearly presented to the social rule, clearly presented to the social point of view. And that's why the moral judgments over such cases supposed to relate also with the economical problem and economical reasons for such an implementation. The argument that some participants will become HIV infected during HIV vaccine trials as a result of a therapeutic misconception cannot be discarded by admitting that such infection could occur, but likely in only a small number of participants. We understand this, but it's also the problem of all vaccines in general. Final issue and final element of the bioethical issue, that's ethical analysis focus on the issues of whether healthcare professionals should be tested mandatorily for HIV infection and or whether their patients should be tested. Patients of HIV infected healthcare professionals who are having invasive procedures run a remote risk of infection. That's important to understand, and that's the case of the harm over the personhood, which we have been mentioned at the beginning of this topic. And so do healthcare professionals from HIV infected patients. And it's important to prevent such a risk, to reduce the level of the risk of infections to the level of the ordinary problem, ordinary disease. The debate about HIV-infected healthcare professionals focus primarily actually on whether all healthcare personnel should be mandatorily tested for HIV antibodies, and if so, whether those who tested HIV positive should be allowed to continue working as healthcare professionals or supposed to prevent working over the medical clinical treatment. And you see that's problem also influence the professional development of the physician, the professional development of the doctors, and the moral judgments, the moral issues over this supposed to be seen at the formation of the career and further development of the career of the professionals. How to prevent such a infection for the professionals? That's the reason for discussion, that's the reason for the social policy itself. A moral obligation to, for example, threat HIV infection patients can be attributed to doctors only if it can be established that they voluntarily agreed or consented to do so as part of their decision and commitment to pursue a career in medicine. And this important decision, this important way of understanding commitment is supposed to be supported by the Social Policy Act, supposed to be supported by the public policy. Morally and often legally, as we understand it's correlated in the sense of the overcoming the problem of HIV, for example, binding professional codes of conduct can indeed impose considerable risk to the parties involved, and had been underlined at this legal or the Code Act. A policy requiring doctors to treat HIV-infected patients might be thought to carry some significant costs, as I have mentioned to you, the cost of the public policy and the cost of the human life. Such a policy is in tension with the professional autonomy of healthcare workers. Here we underline this problem of the professional autonomy and further development of the career. Also, reluctant physicians might provide a substandard quality of care to the patients that such a policy forces them to treat. Kind of conclusion we're supposed to get from the problem of HIV and its bioethical moral judgments. That's for once more the further development, the further theoretical and practical approaches in understanding of such problem to the public needs. First of all, its importance of respect for individual autonomy during all stages of the procedure, during all stages of the recovery, to the doctors, to the physician, and to the person who have AIDS and AIDS disease. Drugs, the second conclusion, that drugs might have extended person's survival time and reasonable usage of them, because, as we have mentioned to you, the HIV/AIDS problem, that's the problem of the surviving and lifetime treatment. For sure, the third conclusion related with the moral obligation of the medical staff, of doctors, to voluntarily agreed action or consented to do as the part of the decision requirement. So the question of HIV/AIDS, the problem of the moral judgments over this issue, over this disease, the relevantly increasing problem, and it will face also the comparison with the other social issues. And we will see how the bioethics will recover, will find the answers over this question. Thank you for your attention.